The data we gathered were published this year in the American Journal of Gastroenterology. We realized that this is a condition that mainly affects female subjects. We started off by excluding the presence of celiac disease and wheat allergy in all the patients included in the study. We performed jejunal biopsy in all the cases. We also performed IgG-specific tests and prick tests to gluten. And all the individuals included in the study went on a 6-month gluten-free diet. This is still an ongoing process for us and an open challenge. Over the last 6 months, we started thinking about the need for a placebo-controlled double-blind trial to confirm this first statistical data. Abdominal pain, bloating, diarrhea, constipation after stomatitis. These are just some of the gastrointestinal symptoms that you could consider as an indication, or rather as a confirmation of the presence of known celiac gluten sensitivity. As regards jejunal strictures in Crohn's disease, we can make a distinction between the so-called primitive strictures, recurrence after surgery, anastomotic strictures without recurrence. Let me now point out a very important aspect. We generally talk about jejunal strictures in Crohn's disease. Most of these strictures cannot be easily accessed by a traditional endoscopy. In general, you would have to use either a single balloon endoscopy technique or a double balloon endoscopy technique to access such. When you have clear symptoms, you have to carefully examine the small bowel to exclude the presence of other strictures. You need to select the endoscope according to the size of the area, and you need to use X-ray. You cannot perform this examination without any radiological support. For most of these strictures, you have no possible access if you only use the endoscope. You need to prepare the site before injecting the contrast fluid. A rigid endoscope is desirable. Only then can you start with the dilation. The trick in my hands in this case is to perform a dilation by using the X-ray images to guide you throughout the procedure.